My name is Emma Amadrio. I'm an obstetrician gynecologist and I work with Nakasero Hospital. So postpartum depression is a combination of words. Depression and then postpartum. So postpartum is the period of time after a woman has delivered, given birth. And that is from delivery up to 6 weeks after delivery. We call that preparium, we call it the postpartum season or the season of her life, that's postpartum. So depression specifically is a medical condition that is characterized with persistent low moods. Someone has persistent emotionally downtime, so persistent low moods. They have loss in previously enjoyable activities, like activities that they used to enjoy. If someone used to enjoy swimming, they no longer want to do that. If someone used to enjoy meeting friends, they don't want to do that. So when you have a period of persistent low moods, loss of enjoyment in things that you previously enjoyed, we call that depression. And it has a whole number of aspects that are used by the psychiatrists to define that someone is depressed. So when we see these features after childbirth, then we say it is postpartum depression. Yeah. And postpartum depression has a spectrum. So there's a mild version that we call postpartum blues. Someone is sad but not persistent and not severe. Then we have the actual depression. So it's a postpartum depression, and it can get severe to what we call postpartum psychosis. And in psychosis, we have moms who are either suicidal or even may want. So I can't say that I've seen many. We don't really talk about mental health, and people shy away from mental health. We think the person is mad. So we don't see so many mothers come out. It is up to the obstetricians and the midwives managing this mother to actually notice that this mother is having signs of postpartum depression. But documented cases are there. So globally, it's around 15% of prevalence of postpartum depression. Then in the low to middle income countries where Uganda lies, it's around 20%. But Uganda particularly estimates at 29% for places where they paid attention to study postpartum depression. But that said, we don't talk about it much. Yeah. So there are some things that can be subtle, and there are some that are obvious. Not every mother will have each of these signs, but they are worth looking out for. So we talked about persistent sadness, so persistent low moods. A mom who has delivered is usually excited, to have her baby. But if she's persistently in a low mood, you won't worry about it. If she has no interest in looking after the baby, remember we talked about loss of interest. So you expect that she's excited, looking after her baby, breastfeeding, changing the pamper. So those are things that should worry you. Persistent crying. The mother is, there are those who get emotional and are always crying. There should be something bothering her. So that is also one of the signs that we look out for. And then as well, we find that some mothers are very irritable, like things that should not be making her angry would make her angry. So irritability is one of them. Lack of sleep. Now already moms go through lack of sleep because of the baby. The baby is crying, but there are those who really fail to sleep at all. Even when the baby is sleeping, they can't sleep. So loss of sleep, or we call them sleep disturbances. That also happens in people who are not postpartum, but we see sleep disturbances as one of the major signs that someone can look out for depression. Yeah, and then anger. Like someone is always angry, they are displacing for some reason, but that can also be a subtle sign of postpartum depression. So there are things that push people over the edge. Sometimes it's just something little that tips them over the edge into depression. So one of them is partner support. if a woman doesn't have a partner, a husband that is there and is supportive, then they will get these postpartum depression features. So it's we find partner support very key. So if someone is alone through their antenatal, they come for delivery and they're still alone, they don't really have social support. There's having, your mom is there or your sister, but also your partner is a very important, person to have with you. Yeah, so that's something that really makes women suffer. Then breastfeeding challenges. So you've given birth and everyone is expecting that you should be able to breastfeed. And the breast milk refuses to come. And it's possible. And you're struggling and you're trying to see that, like the breast milk come, it's not coming. So there are some women that have breastfeeding challenges and they feel like I am not a good mom, I'm failing to feed my child. So that is really key. Financial reasons. So sometimes finances really, you see when you're not even delivering and you're broke, you feel like you can't afford so many things. But now you have a baby, you must afford things. So if you have financial challenges and there are things you need to buy, Pampers, you want to buy baby clothes and you don't have the money for that. So financial challenges come in, meaning a mom should be able to prepare so much before they conceive, during the pregnancy, to have money of their own. And as we talked about the partners, say if a partner is not supportive and you also don't have the money to support yourself and the baby, it can really be depressing. Yeah. And then sometimes some moms have difficult outcomes for their babies, and those are really challenging. Maybe you give birth and baby is small, or baby is a premature or preterm baby, and the baby has to be taken to the nursery. So you've delivered, but the baby has to remain in the hospital, in the nursery, and it's very difficult to deal with. Or the baby has some conditions that are not going to support the baby survive. We call them congenital abnormalities, so the baby is sick. So these really make it difficult for the moms. And sometimes the baby may have passed on, and that even really tortures the family, not just this mother. So even the family that could have supported her, it's a very difficult time. So that really tips people over into depression. Yeah. Another thing is violence, gender-based violence. We don't talk about it much, but there is violence. So you will see a mom, she's given birth, she's very excited, and then she has this really violent husband or partner. Definitely she's not going to have support. Yes, he's there, but you're being beaten, you're being mentally abused, verbally abused. So we can't downplay that so much. It's something that disturbs mothers a lot. Then we say history. In medicine, we say if there is history of something, it will repeat itself. It may repeat itself. So if someone already has struggled with depression before pregnancy, before childbirth, so if they had depression before and maybe they were managed, there's a risk that they could fall back into depression after delivery. So those are risk factors.
Amannya gange mpitibwa Nakyerine Hawa, nina emyaka 3. Embeera y'ennyiike mu maka teyali nnungi twaliza awamu. Kubeera wali nakugambyeko nti nalowoozaako n'okukola ki? Teyali nnungi okutwaliza awamu. Nti nafuna olubuto omwami n'andekawo n'agenda. Ne mbeera mu nnyumba bw'omu, ntandika olyabanja, neetaagisa okulya, neetaagisa okunywa, jjukira omwana oba nakawera oba olina okwoza okola ki, naye nga bina sikola ki? Sibirina. Byagootanamuko kubanga jjukira nali nkola. Bwe nali nkola neefuna ennyiike ku mutima, ne mbeera nga ogenda ku mulimu obeera mukambwe biki bakasitoma ne bakola ki? Ndaba nga beesala, nga beesala ate awo ne ngatamu n'olubuto ne mbeera nga sikyasobola kukola nga simalaako. Teyali nnungi kuba nali mukambwemu, ng'omwana ayinza okujja okugamba ekintu n'okambuwala, olina omukwano nga sikyalina, nga waŋŋamba mami kino sirina, nga mukuba n'omumukuba ne mugamba kati oŋŋamba nze nkiggye wa? nkikuwe nkigyewa nga obukambwe bungi n'obusungu nga bwo bungi nga sikyalina mukwano. Mu budde obwo nali na mami wange naye Mukama n'amutwala ng'akyalina olubuto, kyampisa bubi kuba ne mba nga sirina wa kuddukira.
I think one of the major challenges is we don't really want to talk about mental health. Like, it's not talked about, no one wants to mention it. And even when you notice that someone really needs help, when you talk about, or you're going to invite a psychiatrist to talk with you, the whole family is like, why? How? You know, because we associate this with, we think it's madness. Yeah. We really don't think that mental health is something that, you know, we can all need support for, and we don't think that things are overwhelming sometimes. So that's the biggest challenge we have. I think stigma around saying someone needs mental health support. So even to diagnose it is difficult because we are trying to hide these features. Yeah. And then when you bring this up, patients and their families really feel like no. And then also our society, we expect women to be strong. We think, you know, you're a woman, when you give birth, now you're a mother, you can't be there crying, that the baby is crying, you're so crying. Like, people expect you to be really strong. And I usually tell moms it's okay to cry. Like, if you feel it's overwhelming, yes, have a cry. It helps you get better. It's okay to ask for help. Yeah, so it's the stigma, you know, around it, and it's not, you don't diagnose it much. And then in managing the condition, the limitations come to the specialties that we need. So mostly we work with the psychiatrists, and not very many hospitals do have psychiatrists with them who have time to, you know, see mothers who have challenges in this. So most times when you talk about psychiatrists, everyone is thinking about Butawika Hospital. Yeah. So they're not as many to, you know, all regions and all hospitals in Uganda. We don't have those many. But there are also other important people that work along with psychiatrists. We have the psychologists, we have the ones we call therapists, but we have the psychologists, we have counselors, and these cadres are not in all hospitals. And then we want to have what I talked about earlier, family-centered care. So it takes a village. You've heard that. Yes. It takes a village to raise a child. And in our days, it was really a village. Like, you want a village, there's your auntie, there's your grandma, there's everyone. That village is shrinking in these days, in this time, as we get more digital, more globalized. Somehow we no longer have those, you know, strong knit communities that are there for you, because everyone is at work, everyone has their goals. Yes, so it takes a village to do that. So now your village is us, you know, your midwives, your obstetricians, we are your village, your pediatricians. We are there to help you through, but we want to not just manage you, so manage maybe your mother-in-law or your mother, whoever is coming in to support you through that time of delivery and after delivery, so that we can teach them, your caregivers, teach them how to look after a baby, teach them what to look out for about you. Like, if you notice she's like this, those are maybe signs that you should tell us, because in depression, you, the person that's depressed, may not tell us that, you know, I'm feeling depressed. No, we notice that these things are happening.
Banyambako funa essuuli nti omusomesa waffe bwe yajja n'atukuŋŋaanya ffenna buli omu yamubuuza kizibu kyakola ki kyayitamu. Kati bannange bwe baagenda nga bannyonnyola nagenda olaba nga ate nze kyange siri amaanyi nnyo kutuuka ate bali nga kwegamba nga tusingaganako buki, naye nga ffenna tuli mu mbeera etya emu. Osingabanako n'omulala n'akuwa ku magezi notabeereyo kusirika mumba n'ogamba kansireke tuva olabamu beetuga ng'alaba talina kyakola ki kyazzaako n'agamba ye kati nfa kimensi. Ono omusomesa waffe bwe yajja owa Strong Minds n'atubuulira, nengenda nga nfuna obuyambi lwa nsonga nti nakimanya si nze nzekka akola ki ayita mu mbeera tuli bangi. kati awo ne ngenda nga yalina obusungu ku mutima bugenda bukola ki, bugwako kubanga olimye n'omuntu, munnange kino nakyo nina omunange ekyo kitadde.